Today, we're at Maze Women's Health, and I have a special treat for you guys. We're here with Melissa and Cathleen, and we are talking about questions that clients have given me specifically around women's health, pregnancy, perimenopause, menopause, and just walking through a variety of questions that all have to do with women's health today.
I am Melissa Ferrara. I'm a nurse practitioner with over 20 years experience working with women in women's health and specifically sexual health and menopause health.
And I'm Cathleen Kneidl. I'm a physician assistant with 30 years of experience, and I am a certified menopause provider. I also have an extensive background in weight loss and weight loss medications, etc.
So I just have some questions for you ladies today. And most of these questions are either coming from women who work for me or clientele, female clientele. I put it out to them and asked them, and then I kind of reshaped them so they made a little bit more sense. First question, as women approach midlife, what changes in terms of their health and hormones, and what can they do to stay their best self?
So as you approach midlife, things definitely start to change. Your hormones are changing, estrogen, progesterone, and so you start to notice changes in your body. The most important things that you could be doing is to be eating healthy, kind of avoiding processed foods as much as possible, having a nice healthy balance, eating lots of healthy proteins, vegetables, getting enough sleep is key. Trying to get into good sleep patterns. And
what is enough sleep?
That is individual, but you should not be waking up and feeling tired. It's typically 7 to 8 hours. Some people need a little bit more, some people a little bit less. 4 or 5 hours is typically not enough sleep. That stresses your system and also reducing the stress in your life. You will always have stressors. It's more about how you manage the stress. So finding something for yourself. For me, I like to run. I feel better after I run. It could be yoga, Pilates, it could be gardening, hiking. Just finding something that helps you manage your stress levels makes a really big deal.
Great. What about the role of exercise?
Yeah, exercise is super important. It's cardiac health, it is bone, it protects your bones. It does reduce your stress levels. And when you're feeling better, you're also motivated to eat better. So exercise is very important.
And I think something just to add on exercise, since that's your expertise too, is I think that as we age, exercise that used to work for us when we were in our 20s and 30s, we may need to adjust in our 40s and 50s because the same types of exercise may not be good for us in our 40s and 50s, like really hard like cardio HIIT classes maybe in your 20s are maybe not ideal to do in your 40s and 50s. So I think recognizing that as we age, we may need to change and sort of finding what works in our different decades of life is
and why
important.
do you think that is? Because recovery takes longer?
I think recovery takes longer. I think that our hormones are different as well, so that our response to exercise is different. I think that when we are aging, I think resistance exercise and strength training is really important for our bones. And so I think sort of making that switch and recognizing that importance of sort of even lifting heavier weights. I think I know for me too, I was always all about the 10 pounds and doing 1,000,000 reps and learning that really I should be using heavier weights and lower reps, and building muscle for my bones is really important. And so I think that's sort of definitely a shift as we age, is sort of recognizing the different types of exercise.
Great. And I'd say also too, even just people as a whole tend to confuse. They think that weights is supposed to be cardio with weights, as opposed to weight training is supposed to occur, take about a 2-3 minute break, and that even in your 20s, that's more beneficial than what Barry's boot camp or most people are doing. But as you get older, you're just going to have less muscle, or your muscle is going to have a less proclivity to build as easily. So you have to really dial in your proficiency with training, especially as you age.
Yes.
Great. Can you describe for me the role of estrogen, progesterone, testosterone in women's health?
So those are the three big hormones, right? Estrogen and progesterone for women are primary in when you're premenopausal in your cycle, right? So your estrogen and your progesterone will fluctuate with your cycle in a very specific way every month to produce your period, right? So in a normal cycling woman, you're going to have a rise in estrogen mid-cycle, which is going to help with ovulation, and then a rise in progesterone at the end of the cycle, and they're both going to drop, which is then going to shed the lining of the uterus if you don't get pregnant.
Okay.
And that naturally occurs every month as we start to age and get near that perimenopausal period, which can be years, right? So the average age of menopause is around 51, 52, but you can definitely start having these perimenopausal changes in your 40s. And what happens is your ovaries are just not as efficient. So those really predictable fluctuations of your estrogen and your progesterone start to become imbalanced. So you don't have those really easy cycles anymore. And that's when women will start to complain about sometimes irregular periods, but just feeling different. You know, one month they may have hot flashes, the next month they're fine. Mood changes, anxiety, palpitations, all those things that start to happen because your estrogen and your progesterone are not having those easy patterns anymore. We also see that with PMS, right? PMS is a function of the hormones shifting, right? And so that perimenopause is also the hormones changing and shifting and becoming unpredictable until the point where you go 12 full months without a period, and that's when you officially hit menopause. Now, testosterone's a little different. Testosterone does have ups and downs naturally, but it's women do not make as much testosterone as they make these other hormones. We make a very sort of low level of testosterone, but that tends to drop earlier than your estrogen and your progesterone do. So we start to see decline in testosterone. Usually in your 30s, it starts to go down. And by your 40s, you have about half the amount of testosterone than you probably did in your 20s.
Wow, okay.
So testosterone is really that hormone that's more of the driving force that we see behind libido, energy, mood, muscle. So we definitely find that as we are entering into our 40s, our testosterone levels are significantly lower than they used to be.
Okay, excellent. That's very helpful.
Yeah. Do you have anything to add to that, Kath?
No, I was just gonna say, so as far as what estrogen does for the body is it's, you know, it protects the skin, it's cardioprotective, it protects your bones. So it's doing a lot while it's there. And as we kind of hit perimenopause and we're trending toward those lower levels, you start to see these changes. You see changes in your skin, changes in your vagina. So a lot of that's happening, and then you start to notice a difference in your sleep. You might not be sleeping as much, some joint pains. Again, we think of that like hot flashes, but there's so many other symptoms as our estrogen levels are going lower. And then as testosterone's going lower too, we're seeing lower desire, lower energy levels. So a lot of changes are happening in that perimenopausal period, and people aren't feeling great when that's happening.
Okay. Yeah, and I think estrogen as a whole, especially for men and for women, it's kind of viewed incorrectly. It's somewhat demonized, whereas there's a lot of positive benefits for both men and women for estrogen.
Yes, I mean, those are the big ones, heart health and bone health.
Yeah.
That's why we see, women who are in menopause have, more cardiovascular risks and issues than younger, because they have the protection and osteoporosis. So absolutely. So, women sort of have this drop off of their estrogen, and that has other implications besides from just, hot flashes and night sweats.
What can a woman do to protect themselves from that sudden drop? Or what can they do to mitigate it?
Right. So, I mean, for sure, hormone therapy can be very helpful for women if they want to explore that avenue. Like you said, I think hormone therapy, specifically estrogen therapy, has had a really bad rap. And, when 20 years ago, when the WHI study came out and basically told everybody that like estrogen is the devil, everyone was sort of really afraid of using estrogen. So women were literally pulled off their estrogens, and providers were really told to not prescribe it or only prescribe it when someone is like desperate. And I really think that shift has changed.
Yeah.
We've learned a lot over these 20 years. There's been a lot of new research, and the hormone therapy now is different than what was studied in that specific study. And so, we are finding that I do think more women now, as we continue to talk about menopause and perimenopause and learning the truths about hormone therapy, more women are more comfortable with that idea.
And that's available by a pill if you want to treat it.
You want to take that
It
one?
is available by a pill, but that's not, we tend to use bioidentical hormones here.
Okay.
So estrogen, bioidentical is we do a patch.
Okay.
And using the patch, using the bioidentical actually reduces, when you take the oral form of it, it can increase your risk of blood clots, which is something that people worry about, obviously. And it can possibly affect the liver. So using the
patch just goes right on an arm.
or maybe like where the like kind of where a bathing suit would cover.
Great.
Yeah. I mean, estrogen therapy, transdermal estrogen therapy is considered the safest way to take your estrogen. It can also be delivered in the form of a topical gel or in the form of a vaginal ring. And when you do have an intact uterus, you also need to take progesterone as well, which is also another very important hormone that we kind of talked about briefly before, but progesterone is also really important to help with sleep. And so we usually use those in combination together.
Right. Okay, awesome. And so important to realize what's going on and what you can possibly do to mitigate it, again, because of heart health and because of bone health.
Yeah.
So, and even in my own life, like obviously very different than with women, but I keep my estradiol specifically around 40 to 60, which some people would say on the higher side, but I feel better there. So again, it's been a very demonized hormone. That's a real opportunity for a lot of people to take advantage of if they're feeling off as they're entering menopause.
Right.
We kind of talked about describing each phase of the woman's menstrual cycle and how hormone levels fluctuate. Talk to me about how does birth control impact a woman's hormone levels?
Yeah. So when we talk specifically about hormonal contraception, which would be most women birth control pills, that's the most commonly prescribed birth control out there. There are also injections of hormones. There's a vaginal ring. There's also a patch. Those specifically will suppress ovulation, right? That's how you don't get pregnant. So it's a combination of estrogen and progesterone in the pills, the patches, the rings, or in the injections. And they also have pills that are progesterone only, but they're all meant to prevent you from getting pregnant by suppressing your ovulation. So these hormones that you take kind of override your ovaries and suppress your ovulation. And then you are kind of preventing those natural, normal hormonal fluctuations that would cause your ovary to ovulate.
Right.
And that's how you don't get pregnant. If you don't ovulate, you don't release an egg, you're not going to get pregnant. So those birth control methods that are hormonal will basically kind of even everything out. So that can be helpful for certain things like menstrual control, PMS symptom management, right? If everything is sort of steady and even, then that can be really helpful. But the opposite side of that is when you kind of suppress your ovulation, sort of even everything out, and you don't have those natural surges, we can sometimes see a negative impact on potentially mood, libido, and sometimes even vaginal health too, because your vagina really needs estrogen to be healthy, robust, stretchy, and wet. And sometimes these birth control pills can, for some percentage of women cause them to have dryness, discomfort, and even painful sex.
Okay.
So I think it is important when you are put on birth control of some type, specifically though that type that really suppressed your ovulation, is to be aware of what it's doing. There are millions of women who are on birth control pills and feel great and feel fine and get all the benefits from that. But I do think it is good to know that it is also, suppressing sort of those natural hormonal fluctuations that do have some benefit too.
Right.
It increases a protein in the blood called SHBG.
Mm-hmm.
So that's a protein that's there, has a strong affinity for testosterone.
Right.
So the pill does lower your testosterone levels. It kind of quiets your ovaries down, but increasing that SHBG takes any testosterone that is available, binds up with it, and makes it kind of unusable to your body.
Okay.
So the biggest complaint I get with the pill is just like, lower libido, not as interested, but also I have nice skin and everything because your testosterone is lower. That's that SHBG. Okay. So it also helps with endometriosis because it calms all the hormones down. So
how can a woman identify that they're in perimenopause, since menopause is basically a post-facto diagnosis?
Exactly, right. So, menopause is basically this moment in time when you've gone 12 months without a period, right? So it's sort of this moment. Leading up to that is perimenopause. So you can be in perimenopause for years. Typically, when I'll have patients asking me, well, what is this? Usually, if they're not cycling regularly and having any symptoms of what we would consider perimenopause, which would be mood changes, hot flashes or night sweats, any vaginal changes, any of those pieces, I will usually say, this is perimenopause. It's not unusual for it to start in your 40s. We know we have an average age of menopause, but it is still within normal limits for menopause to occur anywhere between 45 and 55, right? So even if you are in your early 40s and start to experience some of these symptoms, I would still start to classify that probably as the start of perimenopause. It's just this unknown length of time until you meet that 12-month mark.
Okay.
And I know patients come in and kind of is there a test for perimenopause? And there's not.
Okay.
We do look at hormone levels, and sometimes we
question.
can see, so we look at FSH and LH, which are kind of ovarian functioning hormones. So postmenopausally, they're really high because those ovaries are trying really, really hard to do something and they keep pumping it out and nothing's happening. So that's why it seems like the reverse. So those numbers are high and they're low when you're younger because they just boop and everything starts happening. So kind of in the middle, we might see slightly elevated FSH and LH, but they do fluctuate throughout the cycle. So I don't just look at a set of numbers in front of me and say you're in menopause or this, that. I look at the numbers and then I talk to the patient and say, so what are you feeling? What does this feel like? And you kind of put it together. So more so with perimenopause, it's kind of what you're feeling, what's been going on with you, and that's how we make that diagnosis. We can look at labs. They might be helpful, they might not be, but the important thing is what's going on with the patient.
Well, it's probably also helpful that it's only helpful if you have a baseline established prior, right, for these things?
Right. As we're seeing patients, we sometimes start seeing patients in their 30s, and we can kind of, we're following symptoms and what's going on with them, and we can see trends and stuff like that. So it is easier when we have more.
Yeah, and I mean, lab work is still just a moment in time, right? So I do think it is important that you're always holistically looking at the whole picture and, using those numbers potentially as a guide, but it's not a definitive, factor. So,
Right.
I mean, I will say, I see patients all the time, and in a different practice, I work in just a weight loss without hormones, and now women will come to me and say, well, my doctor checked and I'm not in menopause or perimenopause. And I'm like, but did they ask you what's going on with you and what you're feeling? And no.
It's so, when I listen to clients and they talk about their experience sometimes at the doctor office, not at Maze, but in general, I feel a lot of compassion because maybe I've been spoiled because I've been going to Maze Health, but I've also just always made sure that I have doctors that are really involved. And so you hear people and they're like asking questions and they're wanting answers, and this person seems so detached from the experience with them.
Yeah, and I definitely don't feel like you should feel spoiled. Like, you should feel spoiled. And I do sometimes feel like medicine has just become very like, nobody's taking the time to listen to what's going on to patients. And when I'll get all these emails from patients like, thank you for listening to me. And I'm like, that's kind of how it should be, just in general. So it is kind of right. You need to find a provider that's going to listen.
For sure.
If they're not listening to you, then find another provider or ask someone who they're seeing and stuff like that. But definitely, they should listen.
Right. And and I always encourage people, look, find somebody that you respect, find somebody that you trust, and find somebody that you can actually talk to. Like, I see your cousin Nick all the time in the men's side, and I love seeing Nick. So just find somebody that you really can have an actual relationship with and ask real questions and that actually know what the hell's going on with your life. I have a question here, but I'm going to answer it because you guys already did. So the question is, do you have recommendations for exercise change as menopause approaches and arrives? And what about postmenopause? I'm just going to answer it. If I answer it wrong, you tell me. But one of the recommendations here was stop doing like berries and boot camps and things like that and start getting involved in serious weight training. And because as you get older, it becomes more difficult to build muscle and to maintain muscle. Sounds on point?
Absolutely.
And I definitely always think level one is, do you actually like what you do in the gym? Because if you do not enjoy it, you will not go and do it. And I even tell people, like, if they're very interested in like getting jacked, like, I understand most people, at least from the male side, want to be muscular, but you will never be built like me unless you actually enjoy going and doing it. So instead, opt for something you actually like doing rather than something that you're aspiring to. And over time, you'll begin to like it more and more. Coinciding with that, what can women do to offset the risks of muscle loss and osteoporosis? And you can tackle this from hormone, exercise.
Yeah,
nutrition.
I mean, besides from, the resistance training, weight training, which is really important, calcium and vitamin D, right? So you need, I think we screen everyone for vitamin D here. Pretty much everyone is low unless you're on a supplement. So like you should most likely you'll need to be supplementing your calcium and vitamin D. So that's really important. You don't need a bone density screening.
DEXA.
A DEXA in your 40s typically. But when you're older, you would want to do a DEXA screening. I think that, hormone therapy, estrogen therapy can be really helpful for maintaining bone health if that is something that, you're interested in using it for. And I feel like I'm missing one other thing.
What about magnesium? Is magnesium
Magnesium is also another really helpful supplement. It also can help you sleep. So we tell a lot of women to take magnesium as well.
And I think, look, one of the most important things I always talk about, like 80-20, like with a real life, like you will go out to dinner, you will have things like, I did have a protein bar today, things like that. But the majority of my food was actually, it is fruit, vegetables, and then lean protein is most of what I'm consuming in a day. So no one is perfect. Get that out of your mindset. It's not wrong to have something like a protein bar or to go out to dinner, but the majority of your food, it should be fruit, vegetables, lean protein, and complex carbohydrates like beans or things that are able to be utilized, fiber, and things that you can actually utilize for your nutrition. Fiber, so important.
Yeah, I think we kind of treat food like a plaything, and we really need to look at it as the fuel.
It is.
If you got a fancy car, you're putting the fancy gas into it. And so you put the good stuff in, you get the good stuff out. And again, 80, that's my kind of rule too. It's not like 80%, I'm 80% good. And then if I have something, it's small and it's, but trying to eat this kind of clean eating, plant-based.
I said this off camera when we were talking in the beginning, but people would look at me, and if I said I was on TRT, they would think I was in the shape I am, because it's not. It's genetics play a role, don't get me wrong, but it's nutrition first and foremost, and then training and TRT built to a lesser extent. So nutrition is the number one thing, regardless of what you're going through, that you can really do and have control over.
Yeah, one last thing. You know, when we talk about hormones and testosterone replacement and everything, they're kind of that base. If you're not feeling great, then you're not eating well and you're not feeling like exercise, and it just becomes, and then you're stressed.
Cycle.
So if we can balance your hormones, and then you're feeling a little bit better, and then you're exercising a little bit more and you're feeling better, and kind of get the ball rolling in the other direction. So the hormones, they're not the answer. That's not what kind of gets you back into shape. But if you're feeling better, then you can do that, and increasing the exercise, eating better.
I went through, we were going through IVF, my girlfriend and I, and I had to drop my TRT dose down by half, and I was on HCG and all that. I can definitely speak, like, I definitely felt better when I was at a full TRT dose. Like, I was way less tired, and so it's easier to work out when you're not tired and when you feel great about yourself. Are there supplements or changes you should make to your diet to better manage periods, menopause, and perimenopause?
I feel like it's always the same thing. Is kind of eating a generally healthy diet, and a lot of that, I think we live in a very fast-paced society. We're supposed to work like 8, 10, 12 hours a day, bring your kids to soccer practice, and then come home and have a healthy, fresh cooked meal, keep the house, and then start all over again. And that's pretty much impossible. We have to kind of prioritize our health and figure out ways to do it. There's some meal prepping, but it always comes down to kind of eating healthy, getting enough sleep, and figuring out how to manage that in this society. I live in the fast food capital of the world. There's a McDonald's on both sides of the street, so you don't have to pull all the way around. And after a long day of work and doing this and doing that, it's like, you know what, I'll just do that. And that's not great for your health. So trying to figure out how to manage that and balance it out. But I think it's so important to cook at home. That is huge. And it doesn't have to be every night, but it does need to be most nights, and kind of sit down and eat your food, kind of respect your food. But cooking at home is key.
I also always say too, like, meal prep is simply cooking in bulk. So if you have time to sit down for dinner or lunch, don't make one serving. Whenever we make food, we make like extra salmon for me the next day. That's the easiest way to meal prep, just cook in bulk. And I think when we're talking about what you're hearing overwhelming, the theme today is the true biohacks are getting enough sleep, proper nutrition, consistently exercising, making sure that you have meaningful relationships, and managing stress. And these, like, obviously there are things that can help, like estrogen therapy, or for me, TRT, or things like this, but the real biohacks are those things which nobody wants to hear, because those things are hard. And they are. They're just hard. They're difficult to do sometimes. What sort of blood work should women be getting as they're entering their 30s and later on into their life?
So, I think, yearly sort of baseline blood work would most likely just be like a complete blood count and a chemistry, just to check that you're not anemic, to make sure that your cholesterol is so in line, lipid panel, liver function, kidney function. I think a baseline once a year is good. Thyroid check, vitamin D level, maybe some B vitamins too, especially, in, premenopausal women, you want to make sure that you're got your D, your B, that you're taking those. So I think, I don't think you need to really do that more than once a year if everything is screened normal. Again, if you start having these perimenopausal symptoms, if you do want to have more detailed hormone workups, I think that's fine. Although, again, keeping in mind, it's this snapshot view and 1 minute on one day. And, just because you have that done and someone tells you like, oh, everything was normal, if you're symptomatic and you don't feel well, then, find a specialist that's going to kind of evaluate that more for you. But other than that, do you have any other? Oh, and your regular screening test that you should get as your your PAP, you should, your cervical cancer screening should be done. That is now done every 3 years, depending on history, depending on what kind you get. Obviously, if you're sexually active, and you should probably have STI screening too done, and mammogram once you're 40, colonoscopy as well, 45.
This is actually my next question, so this is great.
Yeah.
What about EKG? Does that need to be done?
Yeah, that's a good question. I guess it would look at your kind of history. Do you have heart disease in the family? They do routine screenings here and there. Probably if you're not having any issues, yeah. Right. Yeah.
Yeah.
And mammograms, how frequently and how often, right?
It's changing.
That does keep changing. I still recommend yearly
Yearly.
when you're 40,
Okay.
and then potentially even earlier screening baseline if you have a strong family history.
Okay.
But I still recommend yearly at 40.
What about coronary calcium scans or like clearly these things?
So
Are those
I
important for
think,
women?
I think that would be based on obviously family history and what your cholesterol levels are when
Right.
you have them done, right? So if you do, if you check their cardiac risk factors, and one thing we didn't talk about is smoking. I can't believe smoking has not come up yet. Oh my gosh. So one of the biggest cardiac risk factors is definitely smoking. So nobody should ever smoke.
Yeah.
I can't believe we didn't mention that. But so obviously if you're a smoker, if you have high
Hopefully,
cholesterol.
if you're following me, you're not smoking.
Yeah,
It's probably
yeah.
likely.
So if you have high cholesterol, if you're a smoker, you probably would be more likely want to get a coronary calcium score done.
Yeah.
But if you're really low risk and your cholesterol is normal, then I don't think that's a necessary test for you to do.
Great.
Yeah.
Okay, great. What is hormone replacement therapy and how does it function in the body? Outside of estrogen therapy, which we've already talked about, or you can talk about that as well,
Okay.
but hormone replacement therapy for women as a whole.
So we've changed the terminology, and it's not hormone replacement anymore. We do more of a menopausal hormone therapy.
Okay.
So
That sounds less scary.
Yeah, and we're not, because the goal, we can't replace all of your hormones that you lost, right? So
Yeah.
it's really more about hormone therapy and hormone and symptom management, right? So
we again kind of assess the symptoms and kind of see what's going on. But the three main hormones that we work with are estrogen, progesterone, and testosterone.
Okay.
And so not everybody's a candidate for estrogen therapy, and that's okay if you've had breast cancer or anything going on like that. That might be off the table, but maybe testosterone isn't. So again, it's all very individual, and it might not even be replacing those hormones or doing therapy with them, but figuring out different things. But the three main ones are estrogen, progesterone, and testosterone.
Right.
And when I evaluate a patient for hormone therapy, I'm usually asking them, well, what are your most bothersome symptoms? And you may be someone who we're going to layer all these hormones in for, but let's talk about what's your most bothersome symptom now and where should we start? I trend not to put everyone right away on everything. I kind of want to get an assessment. So if I have someone who comes in and their most bothersome symptom is hot flashes and night sweats and they can't sleep, I'm more likely to talk about estrogen and progesterone, as if I have someone who comes in and says, well, my most bothersome symptom is my lack of libido, right? Then I may trend more towards testosterone therapy. So that's sort of where I always look. We have some women who do need to be on all three hormones, and that often is a process, right? So you don't always get the right dose, the right route right off the bat. So usually what I will tell my patients is I'm your partner. We're going to work on this together. We're going to try something. We're going to see how you feel. We might need to change something. We might need to adjust something. We might need to add something in. We might need to up a dose. We might need to decrease a dose, but just keep coming back.
Yeah. Amazing.
Right. I mean, because that I think is really important, because I think for a lot of patients, when they are talking about hormones, they're talking to their gynecologist, who in these big practices now has basically like 10 minutes to screen you for all cancers, make sure they've done all their proper tests, and then, a discussion about hormone therapy needs a half an hour, right? Like it's not just a 10-minute discussion. So I think that if you are someone who is interested in hormone therapy, don't do it at your annual GYN exam. Make another appointment. Go specifically for that to talk about it, because you're not going to be able to get it all done in one visit, and you may need to go back a few times, and that's okay. That's the way it should be. This isn't something that's done at your annual and then you don't see your provider again for a year.
Yeah, I'm laughing because the number of women who I've talked to as clients who try to have this conversation with their gynecologist and it basically goes nowhere, and their feelings of frustration about it. I mean, it's probably finding a different venue or a different physician is the right way to approach it, because it never works out from my client's perspective the way they're hoping it will.
Yeah, and I think that going prepared to an appointment as well with some information can also be really helpful. I think there are a lot of, we're really lucky now with all of the information that's out there now on the internet and Instagram and podcasts, that you can really be educated before that appointment with an idea of, maybe what you're interested in to, and get their opinion. But I do believe that if you aren't given the time, then it's time to find somebody else.
Great. At what point should a woman start considering hormone replacement therapy?
When they're feeling symptoms.
Okay.
Yeah, so there's not a point in time like at 49 you should start thinking about this, but no, when you start noticing, and sometimes I notice it's the it's the sleep, or a little bit of mental fogginess, and then things kind of start heading from there. So if you're not feeling quite like yourself, then that's a good time to start talking about it, even if that's not quite the time to start it, but to start talking about it and figure out when that would be.
And what we do know about menopause therapy is that it is important that the timing of when you start the menopause therapy is important for to optimize the benefit of it. So you really do want to begin your hormone therapy within 10 years of your menopause. And I would say it's even better, it's best to do it when you're sort of most symptomatic and sort of starting out earlier in that process, because as you go longer and longer years without those hormones, that's when you're more likely to develop osteoporosis, cardiovascular disease, so we want to start that early and help with prevention. So, it really is when you are starting to see symptoms worth starting those discussions.
Okay, going along with questions for pregnancy, what recommendations in terms of nutrition, lifestyle being sleep, things like that, like how often you're going out, drinking, etc. What recommendations in terms of nutrition?
Don't drink while you're pregnant.
Yeah. Don't smoke. Don't drink. What recommendations in terms of nutrition, lifestyle, and supplementation do you have for women during pregnancy and then during breastfeeding?
Good questions. Yep. So while you're pregnant, you definitely want to optimize your nutrition and be eating healthy, drinking plenty of fluids and taking care of yourself. The calorie increase that you need while you're pregnant is not as much as people think. Like, you're not eating for two, you're eating for one and a little one. And so sometimes people kind of get into this, like, I can eat whatever I want and this is great, and that's not it. You do need to eat a little bit more, but it's not an extra bowl of ice cream at night. Just continue that healthy diet, focusing on you're focusing on your protein, getting plenty of fiber. Your gut kind of slows down when you're pregnant due to the progesterone, so it increases your risk of constipation. So it is important to get plenty of fiber.
And foods with fiber are so high in antioxidants, micronutrients, polyphenols. So what was the other?
prenatal
prenatal vitamins. You want to be definitely taking your prenatal vitamins.
Is there one you recommend?
No. I
Okay.
mean, one that you'll take.
Okay, great.
Because some of them are like horse pills and really hard to swallow. They do make chewables now. You can get prescription.
Great. Do you recommend that, or a generic one is fine?
I think a generic is fine as long as you're able to take it. So
By the way, I
definitely
hate
want-
answering that question too. Which one should you take? Like, I
Yeah.
hate answering that question.
Yeah, I don't have a specific
I
brand
got it.
that I recommend. I think that it is just important that you are taking them, and so finding one that you can swallow and tolerate, I
Right.
think is important.
Vitamin D, calcium.
Most of your prenatals are going to have a lot of those things in them already. I think sleep is, again, really important. You're going to need that sleep, and continuing exercise. Exercise during pregnancy, I think, is really important.
That's actually my next question.
Yeah. Lower.
Sensitive to the joints.
Mhm.
Great. What about omega-3s? Fish oil. Important during pregnancy, or me?
I'm not sure.
Not vital. Not vital.
Yeah. No, I don't want to make a recommendation.
Great.
As far
Yeah.
as I'm not sure if it affects blood clotting.
Right.
and
Yeah.
stuff
Yeah.
like that.
Right.
Okay.
I would
Fair
say.
I don't have the answer to that.
Fair enough.
Yeah.
Magnesium.
Yeah.
I would say to stick to your prenatal
Great.
vitamin.
Yeah.
Because
Great.
that is going to
Amazing.
have everything kind of balanced out. I do think they have ones with omegas in them, or the DHA
Yeah.
in it. So
Great.
yeah.
Do you have any separate recommendations from those for women who are preparing for pregnancy? So, like, as opposed to being pregnant,
Yeah, so for preparing for pregnancy, I would start that prenatal vitamin because that has that folic acid that you need that protects the baby's spinal cord. That spinal cord is developing before you kind of even realize you're pregnant. So it's great to have that on board. And it is a multivitamin. So it's safe to take before you get pregnant. And again, just reducing your stress levels. If you're constantly stressed out and activated all the time and your cortisol levels, that affects when you're trying to get pregnant, it affects your hormone levels, and it can make it more difficult to get pregnant. So it's important, again, to get that sleep, be eating healthy, have stress reduction in there. And as far as breastfeeding, it's continuing on that prenatal vitamin, drinking plenty of fluids, and eating healthy you're feeding a baby. So your metabolism is up. It's great. That breastfeeding helps to shrink your uterus back down. It helps with your metabolism. So it helps with some weight loss. But you need your proper nutrition to make that good healthy milk.
Breastfeeding is actually more calorically intensive than being pregnant, correct?
Yeah.
Yeah, okay. All right, great. So final question on pregnancy, we kind of touched on it, but thoughts on exercise and a level of exertion when trying to conceive or pregnant?
I think while trying to conceive, if you're a marathon runner and you're not having a lot of body fat, you do need some body fat. To maintain that normal cycle. So, but otherwise, your general routine exercise should be fine.
So you can lift heavy 3 days a week or do some minor cardio, stuff like that.
When you become pregnant, that progesterone has an effect on your joints too. So then you're still gonna exercise, but you might kind of take it down a notch.
Right.
I mean, people still run or do whatever. You have to, it is very individual. You're not gonna increase your exercise levels when you become pregnant. So if you weren't a marathon runner, that's not what you're gonna pick to start doing. But you do wanna maintain, even if it's just getting out for walks, you can do some weight training, maybe lighter weights, so that's gonna be very individual.
Great. Okay, and final two questions. Any recommended resources you would direct people to on this topic? So particularly, what would you direct people to on the topic of maybe the pregnancy or menopause, perimenopause, any kind of things that you can think of with women's health that are good resources that are out there?
I mean, I feel like our website is a great resource.
There you go.
Yeah, I think May's our website has great resources. I think that, specifically for menopause, there are some really great websites out there now that have a lot of information on menopause. Electra Health is one that's really good. They have a lot of information, so I think that's a really great menopause website. May's Women's Health, we have our own website, and there's lots of information on there. There's also some really great podcasts on menopause out there. The Inside Information with Dr. Lauren Stryker is one of my favorites. I think she's great. She actually even has one episode dedicated to musculoskeletal health in menopause with orthopedist Dr. Vonda Wright. It's amazing. So I think for menopause and perimenopause, that's a really great podcast to listen to.
Great. And what was the other site?
Electra Health is a menopause website that has a lot of great information on it.
Last question. If you could tell women between the ages of 30 to 55, 3 things besides what we talked about today, what are they? You don't have to take this too literal, but if you wanted to talk about women's health, what are some of the stuff that we didn't cover today, or what would be your overall message? So for example, when people come up to me in the grocery store or at the gym and they recognize me from social media, and I have to give them like 3 takeaways, I always tell them fiber, I always tell them protein, and I always tell them VO2 max. Like those are the things I tell them. That's like my constant message to people is VO2 max, #1 correlation with longevity, maybe depending on the person, BMI or body fat percentile is important for them. But most people don't know about VO2 max, they don't know about fiber, and it's still good for people to hear about protein, even though everybody's hearing about these days.
I mean, so we didn't talk at all about vaginas today, which is amazing because that is all I do all day is talk and look at vaginas. So I would say, one of my takeaways is always pay attention to your vagina.
Yep.
It shouldn't burn, shouldn't itch, shouldn't hurt. Intercourse should be pain-free. If there's any issues, regarding that, see someone. If you don't get the answer you want, see somebody else.
Right.
Never give up on your vagina, especially in menopause, especially with estrogen, lack of estrogen, reducing elasticity, lubrication. That would be my takeaway is pay attention to your vagina, pay attention to your vagina. You want it forever. You want to use it forever.
Okay.
It's really important.
I actually love that. I love that. Right.
My takeaway is a little different. So I talk stress. I talk about stress. You need to figure out ways to kind of manage your stress and kind of take care of yourself.
Yeah.
Don't lose yourself in your family and everything. You need to kind of find your happy place, even if it's 5 minutes, just take a deep breath, kind of bring your heart rate down. I focus less on, when I do weight loss, we always talk about numbers and weight and body fat percentages and stuff like that, but also, how are you feeling? Do you feel are you feeling better? Are you feeling healthier? Because being healthy is more important than those numbers. And just be kind of gracious to yourself, and just, we're aging. And so our bodies are different than when we're younger, and they've been through a lot, and I'm just happy to be here.
Great. Yeah, I actually, the next interview I'm going to be doing is with a therapist who really is in stress management, because it's just so important, remove the stigma of therapy, but also just get people to understand how impactful stress is. And even if you're a meathead like me, now I'm a meathead with a family and a business, but even when I'm younger, your body perceives stress the same way, whether it's from training or everything else. So even just from a standpoint of performance, you also need to mitigate stress, but certainly for health. So. Well, I just want to thank the two of you for taking the time. Really what I'm hoping here is just women can because the overall message here is really what we all kind of already know, which is great, because that's really what the message I produce all the time on social media is, that there aren't really these secrets that they're missing out on. So I really appreciate you helping me pull back the veil, and really, really glad to spend time with both of you. So thank you for your time.
Thank you.
Thank you.